Adipo or Adipo. You can say it either way. You'll hear it pronounced either way out in medicine. It's not a hard and fast pronunciation. Choose which one applies better for you. It means fat. We have a couple words for fat, and so this is the first one. Adipose means pertaining to fat, and so just for an FYI, adipose tissue is a layer of fat beneath the skin. Adipocele is a hernia-containing fat, so sometimes, to clarify, herniation is something going through a muscle wall. So sometimes we'll have a collection of fat cells that will push their way through a muscle wall. They cause a herniation. That's an adipocele. An adipocyte is a fat cell, and you see a photograph of that here, of a photograph of a slide, and it shows an adipocyte. And an adipoma, pardon me, let me try that again. Adipoma is a fatty tumor. And so that's just the word we would have. If we have that adipocele, that herniation containing fat, it likely results in an adipoma, which is a fatty tumor. So those are our first set of words that we'll use talking about the tissue that we commonly call fat. There's another word, however, we're going to apply, and it's lipo or lipo, once again, depending on what you have learned and what you typically say. Typically, we would say lipo, as in lipocyte, is a fat cell. A lipoma is a fatty tumor. A lipocele is a hernia containing fat. Lipectomy would be excision or removal of fat. And liposuction is excision or removal of fat also. Two different techniques. You have probably noticed that the suffixes on the first three are very similar to the previous page. So are these interchangeable? Pretty much, yeah. Lipo is the one that's probably more commonly used in dermatology and in plastic surgery, things like that. Especially when you see the term liposuction, which I'm sure you've all heard of before as being a cosmetic procedure. However, it isn't always. Sometimes it is the excision or removal of fat in form of a lipoma. And so lipomas are, by the way, benign tumors. They're not malignant. They can be unsightly, and sometimes people will have them surgically removed. And liposuction might be one way they go about that. And of course, we always associate liposuction with an elective procedure. Now, we have two combining forms for sweat. You'll recall that I gave you earlier in the semester, we talked about two words that sound the same. They're spelled differently. Hydro with a Y, hydro with an I. Well, here we're using them in the form of combining form, and we're talking about sweat. So always remember, hydro with a Y is about water, as in hydration. Hydro with an I is about sweat, and we'll have some words that will attach to that. The other combining form we have here for sweat is sudoro, or sudoro, depending how you want to say it. Either way, either of these forms mean either, and both of these forms mean sweat. So for hydro, we have hydrosis, which is the act of sweating. It's very common in mammals. We actually need this. It helps remove toxins, helps cool the in heat. Anhydrosis, absence of sweating, is more of a dangerous situation for humans than it would be, say, for pigs. Pigs in themselves cannot sweat, and anhydrosis means the absence of sweating. So for pigs, that's kind of normal. But for human beings, if you were in a condition where you have absence of sweating, that would be abnormal, would probably require a workup from an endocrinologist to kind of figure out what was going on. And likewise, hyperhidrosis, an abnormal condition of excessive sweating. So this is a situation where maybe conditions don't really warrant it, yet the body is producing sweat nonetheless. Nervousness can cause this, anxiety, anxiety, and sometimes simply just an endocrine disorder might trigger this. Also, certain medications might trigger this condition. It is treatable. It's something a dermatologist and or endocrinologist can address. And the other word, of course, sudoro, or sudoro, meaning sweat. We're only going to give you one word here, and it's going to be kind of an important one. Sudoriferous means producing sweat. So you do have something, as you can see in this diagram here, called a sweat gland. Officially in medicine, and when you take anatomy physio, they're not likely to call it a sweat gland. You're more likely to hear the term sudoriferous gland. And so when you do, you'll know that sudoriferous means producing sweat. And technically, if you really want to break this down, it means pertaining to producing sweat, right? Because OUS is a pertaining suffix. You're starting to probably see now that some of those very strict definitions as in pertaining to kind of start getting loose. And the reason for that is you've worked with these suffixes. You're likely to remember that, I hope. However, if I asked you to give me the definition of a sudoriferous and you said producing sweat, that would be perfectly acceptable. Okay, and something else related to sweat. Diaphoresis. Dia is a prefix meaning through or across. Phoresis means carrying. That, I believe, is a new suffix for you. Once again, those words, like I pointed out earlier, it has a prefix and a suffix, and there's no combining form or word root. So that big exception to the rule that we laid out at the beginning of this semester. Diaphoresis means profuse sweating. And if we were going to talk about someone who is producing profuse amount of sweat, we would say diaphoretic. If you work in cardiology and someone reports the symptoms of chest pain radiating down the left arm, left jaw pain, pressure on the chest, one of the questions you may ask them is, are you diaphoretic? Now, you may not ask that way. You may say, are you profusely sweating? They may say yes, and then you can chart positive for diaphoresis, or a patient complains of being diaphoretic. That's a very common way of using this term. You will hear it a lot in cardiology. It is one of the symptomatic elements in the symptomatic profile of heart attack. So diaphoresis is important not only to cardiology, but that's at least one place where you hear these two terms being used fairly frequently. We have a gland here that's inflamed. So we have hydr, which is now being used as a prefix as for sweat. Adden is our combining form or word root in this particular word, and that means gland. And itis means inflammation, which gives you a hydradenitis, inflammation of a sweat gland. So don't get confused here. I know hydro, the hydro combining form was just presented to you a moment ago, and it may seem like it's only a combining form, but as I've said before, combining forms sometimes evolve into suffixes or prefixes. Sometimes prefixes or suffixes will form into a combining form. I know it seems kind of scattered, but just trust me, that's the way it works. This is a legitimate word, and here we see it being used as a prefix. In reality, it's just a compound word being tied together, but the way they present it sort of looks like a prefix. So I just wanted to clarify that. Hydradenitis is inflammation of a sweat gland. Another condition of skin can be a fungal condition, and myco is our combining form for that, as in mycology, the study of fungus. Mycosis is an abnormal fungal condition, and more specifically, dermatomycosis is a fungal infection of the skin. More precise, because we can have fungal infections in different parts of our body. We can have it actually on the mucosal lining inside your mouth, and then it wouldn't be dermato, it would be a different type of mycosis. So mycology is a general study. Mycosis is a general term describing abnormal fungal condition. Dermatomycosis is a fungal infection of the skin in particular. Tinea, a term for ringworm, which is not actually a worm. It's a fungal infection, and its name commonly indicates the body part that's infected. So you see tinea corporis, which would be a fungal infection of the skin on the body. Tinea pedis, otherwise known as athlete's foot, which would be a fungal condition that we would find in the feet. And tinea curis, which is jock itch. So not so much for the first one, but for the latter two, the athlete's foot and the jock itch, these are environments that don't get exposed to a lot of fresh air necessarily. They're an enclosed environment. There's moisture. There's not a lot of light. And so fungal infections there can not only start, but can be really tricky to get rid of. So they're going to take persistence. Tinea corporis usually is something you can resolve quicker, but they all sort of result out of the same reason. There's a fungus that's come in contact with the skin. It's set up shop. And now we need to treat it with topicals and sometimes with orals in order to get rid of it. And when I say orals, I mean oral medication versus topical medication. Tinea typically is a topical medication, but not always. Here's another combining form for you. It's getting back to the accessory organs we discussed earlier. Onycho, which is our combining form for nail. Onychopathy is a disease of the nail. Onychomycosis is a fungal infection of the nail. So there we're using, once again, a more specific form of mycosis. We're saying this is in the nail, and to be more precise, the nail bed. Onychomalacia is a softening of the nails. And onychoma is a tumor of the nail or nail bed. And onychophagia is nail biting. So that's usually a type of disorder that has more to do with anxiety responses than anything else. And if you've ever gone through this or seen anyone go through it, it can be challenging to get rid of, but it is something that can be conquered. So if you ever have a patient or a loved one or yourself and you're dealing with onychophagia, it isn't forever. You can resolve it, and it just takes some time. Do note here also, there's that phagia suffix with GI in it. And if you recall, I said the GI tract stands for gastrointestinal, which usually means to eat. So onychophagia literally means eating the nails, but it's just kind of a hybrid term that we use for nail biting. And so if you caught that and saw we were using that suffix in that context, you were absolutely correct. It does typically mean that we're going to eat it. Hopefully you're not eating the fingernails that you're biting, if you're doing that at all. And if you are, you probably want to halt at least the swallowing of them. Okay. Moving on to tricho, as in trichopathy, which is the disease of the hair. So tricho is our combining form that means hair. Trichopathy, as I said, means disease of the hair. Trichosis is an abnormal condition of the hair. And trichomycosis is a fungal condition of the hair, which you see illustrated in the two photographs in the lower right. So as I said before, mycosis is a general term. You can see since that slide, we've had a couple of different conditions where we've added more specific body parts. So yes, trichomycosis is a form of mycosis, but specifically, when in the case of trichomycosis, it is a fungal condition of the hair. And of course, we have other sorts of diseases that might come along with it. We have trichophobia. This is a fear of hair or disgust at the sight of loose hair. It's one of those things that it's either a learned behavior or it's embedded in something else. It's simply a sight of loose hair lying around that you particularly don't like. Could be pet hair, could be human hair, as we see in the pictures illustrated here on the right. There's also trichotillomania. This is an irresistible urge to pull out hair. This is an impulsive control disorder, which means it's probably rooted in some sort of anxiety disorder. Usually begins around mid-teenage years, and they don't clearly understand all of it, but once again, impulsive control disorder probably covers a lot of what is going on with folks who suffer from this. It affects about 4% of the population, and women are 4 times more likely to be affected than men. I've seen this in varying degrees. I've seen a couple of patients be treated for it, one successfully, one not so much. In her case, she was doing, as you see in the top photo here, plucking eyelashes. And although eyebrows, as you see in the middle photo, and in some cases, it's a compulsion to wrap the hair around the finger and pull it out of the head. It may sound abnormal if you've never heard of this, and it is an abnormal condition, but it is treatable once again. It usually is one of those things that will resolve on its own, but then given the symptom that it produces or that we can observe, that is the removal of hair, patients often want to deal with it before it becomes too much of an ordeal. And to be quite honest with you, in my experience, it's usually a family member who points this out to us, not the patient themselves. In the cases I've seen, and both times, the patient was kind of unaware that they were doing this, which sounds odd. But that was the situation. They were unaware that they were pulling their hair out. It was compulsive and impulsive. It was something they couldn't really control. So one case was successful. One case, the last I saw, was unresolved. I hope that that patient has resolved it, because this is a condition we don't want to have someone carry off into the future. Okay, there's my 15 minutes. I'm going to go ahead and hit the pause, and I'll be back with you in a moment with some more words dealing with the skin.